Thank you for your interest in guidance related to children turning 3 during COVID-19. My name is Brian Klimkowitz. I'm the Special Education Division Director at the State Department of Education. Co-presenting with me during this session is Andrea Brunell, Educational Consultant within the Bureau of Special Education, and Diane Murphy, the Connecticut State Department of Education Data Manager from our Performance Office. This session is designed for special education directors, Sedac data managers, as well as early childhood administrators, and is based on our live webinar, which was held July 9, 2020 on last Thursday. During this webinar, the CSDE will provide an update related to children turning 3 on or after March 16th, whose initial comprehensive evaluations were delayed due to public health mandates. Information shared will include a review of Executive Order 7DD, LEA responsibilities related to FAPE at 3, data reporting procedures and requirements related to FAPE at 3, and an update on funding for the expansion of early intervening services for children over 3. Before we get started, I would just like to thank you, our participants and listeners, for your leadership and contributions supporting your students and staff through this pandemic. In addition to this recorded webinar, the CSDE has released and posted a guidance document as an update to our April 23rd topic brief, dated July 9, 2020. This document can be found on our CSD website. In April, the Governor's Executive Order 7DD was a real win for our youngest learners and their families. It allowed for children within the birth to 3 system an expansion of early intervening services, where as a result of public health mandates and social distancing, school districts were unable to conduct comprehensive evaluations which required in-person assessment practices, thereby delaying a district's ability to make an eligibility determination under IDEA Part B. This expansion of services was allowable for students who turned 3 on or after March 16th, as I mentioned earlier. Despite this expansion of services, LEA's responsibilities for FAPE at 3 remained, as there has been no waiver of IDEA requirements. As such, our previous guidance emphasized the need to maintain contact and communication with families and birth to 3 providers, convene remote PPTs to review referrals, and design comprehensive evaluations. Some planning and placement teams were able to make determinations when there was sufficient evidence to do so and offered IEPs for students who were eligible. Others were not able to, as evaluations that were designed required in-person assessments, which delayed this process. In these circumstances, parents were able to access continued early intervening services. As of July 6, 2020, the Governor allowed school districts to resume in-person ESY, extended school year, and/or summer school classes, as long as school districts were able to comply with CDC requirements, and every effort should be made to safely conduct evaluations. At this point, I'd like to turn it back over to my colleague, Andrea Brunell.
Thank you, Brian. Hi, everyone. CSDE was recently informed that the funding for expansion for early intervention services over age 3 that has been provided by OPM will continue through August 31st. Please know that Connecticut is one of very, very few states that authorize the use of state funds to make sure that children did not have a gap between services between Part C and Part B due to the COVID-19 pandemic. I've received many questions about continued funding for early intervention over 3. Unfortunately, we're unable to use either IDEA Part B or Part C funds for this. The value Connecticut places on meeting the needs of our youngest learners was very apparent with this state-funded effort, and we are very thankful for the support we received from OPM. As the pandemic moves forward, this may be revisited, but this is the information we have for now. We truly empathize with all of you and how quickly situations can change during these unprecedented times. We ask that you make your best effort to evaluate and determine eligibility for all children who have been referred from birth to 3 with birthdays after March 15th and over the summer. The responsibility for LEAs to complete summer evaluations for children transitioning from birth to 3 with summer birthdays hasn't changed. What this means is that you'll need to revisit the decisions that were made at PPT 1 for children that the PPT decided after a robust conversation could not be evaluated without face-to-face assessments, and families chose to receive early intervention over 3 services. You may find that you can gather additional information from the birth to 3 provider, or that the birth to 3 provider may be able to complete some additional evaluations. You are also able, as of July 6th, to bring the child in for an in-person evaluation, remembering that health and safety always come first. You may also want to take a look at the norm-referenced assessment tools for children birth to age 5 with potential for remote administration for eligibility determination resource that was developed by Daisy and ECTA and is located on the CSDE webpage under Special Education COVID Resources for school, district, and special education leaders. Again, I know it's difficult when things keep changing, but we're in uncharted territory here, and what all of you are doing gives new meaning to the saying, building the plane while flying it. This is where we are today, and we will certainly continue to advocate for a continuation of early intervention over 3 funds should our circumstances change. Please know that we really appreciate all you're doing and how hard you're working. Also, remember to document all of your efforts to complete evaluations and do the best you can. As always, feel free to be in touch if you have any questions. I'd like to introduce my colleague, Diane Murphy from the Performance Office.
Good morning. For all students who were referred from birth to 3, evaluated and found eligible, however, their IEP was implemented after their 3rd birthday, districts will need to report the reason that FAPE at 3 was not on time. In the case of COVID-19 closures, if PPT 1 was held, an evaluation plan was developed, but it was later delayed because it could not be completed in person, these students should have had early intervening services over age 3 offered by birth to 3. Districts should immediately complete the evaluation for these students and ensure that the IEP is implemented before September 1st. To be clear, there is a new reason for delay allowed in Sedac that requires the 3rd birthday for these students to fall between March 16th and August 31st, and the IEP start date from page 11 must be on or before September 1st. Districts can report this reason at the top of page 12 of the IEP. The reason FAPE at 3 was not met is a hand entry only field in Sedac, so you must gather the information from page 12 of the IEP. Students who meet the 2 edit checks and are reported with the reason FAPE at 3 not on time equal to COVID closures, EIS over age 3 offered, will count as on time for indicator 12 in the IEP. Next. This is what the Sedac selection looks like. The highlighted section is the EIS over age 3 option that will be reportable for the 10/1/2020 Sedac. Remember those 2 rules: date of birth, March 16th to August 31st, and IEP services implemented, the grid on page 11, on or before September 1st. If these 2 rules are not met, one of the other options listed here should be selected. Please remember, if you select other, you will have to provide a written statement, and that record will receive a citation for FAPE at 3 not being provided on time. Next. It is important to remember that compliance with FAPE by age 3, which is indicator 12 in your APR, is different from compliance with the evaluation timeline, which is indicator 11. If the student is referred from birth to 3, had their IEP in place on their 3rd birthday, please report in the evaluation timeline the reason 06, which indicates you implemented the child's IEP by their 3rd birthday. If they did not have their IEP in place, for example, the students we're talking about this morning who had EIS over age 3, for all of these students, you must determine whether or not you met the state's 45 school day timeline from referral to implementation. Since COVID-19 school closures do not count as school days, it is highly likely you can complete and implement the IEP before 45 school days have occurred. In these cases, report in the evaluation timeline collection, reason for delay 7, we met the state's 45 school day timeline. If you did not meet the 45 school day timeline for any students, please determine if any of the other options are applicable. For example, did the parent fail to produce the child for evaluations even after you were able to schedule safe in-person evaluation options? If another reason for delay is applicable, please report that in evaluation timelines. Otherwise, students reported with reason for delay 8 will count as late on indicator 11 for the APR for the applicable reporting year.
During our live webinar on July 9, participants had an opportunity to ask questions during the session. We've collected and answered those questions and will be posting the document on our Special Education COVID-19 resource page on our website. If you have any questions after reading the guidance document and/or viewing this webinar, please do not hesitate to contact us, and you can see our contact information within this PowerPoint. Please remember the CSDE is here to support and assist you. We know that COVID-19 has impacted your ability to meet compliance requirements. We appreciate your continued efforts to ensure safety for your students and staff, and your efforts to ensure students receive the supports and services that they require to be successful during this very challenging and difficult time. Once again, I'd like to thank you for your interest in this topic, and thank you for the work that you're doing to support our youngest learners. Be well.